ultimately, we are in a society right now that doesn't even have parity with Medicare for our children, right? So we're not valuing our children. We don't even pay attention to it. It's a small, if they don't vote, they don't have any kind of influence. And so we're not, and those of us that are advocating for them, we don't have a lot of influence because there's not a lot of us either. We don't have a lot of power. And so we can do our best to try to raise the voices. But until the society and the community values children, ultimately all of this is sort of, unless we separate it out as a separate program. This is not a healthcare program. This is a preventive medicine program. This is your sick care program. This is your well care program.
But I think if you talk to anybody, I don't care how far right libertarian, that we should do away with K through 12 education, they tell you you're absolutely nuts. And they would stop talking to you.
Should talk to some people here. There are people here who think really they don't want to get rid of K through 12 education, but they really don't necessarily think we need to be doing all the things we're doing in K through 12 education, and it should cost a lot.
Okay.
Yeah. The best
And I
years,
think if you ask most people, is it ethical not to
No,
invest?
I agree. I agree completely. But I think
The
most people,
conversation changes. They're like, most people, like say 90%, 80% of people say it's not ethical not to invest in the future. People feel that the baby might not vote, but the mama votes and the
Mhm.
grandparents vote. And if
Mhm.
you make it you really want your grandchild to grow up sick?
Yeah.
but the
But when
business,
they go to actually vote, they don't always vote based on their ethics.
yeah, the people that are running the business,
Oftentimes they vote based on their concern about self, their
Yeah.
self-interest.
Right.
So
Or their one
their
issue,
emotion and their self-interest.
their
Exactly.
one issue,
Yeah. And so even though theoretically they might say one thing, when they go to the ballot box and they go to vote on whether or not to increase their taxes to pay for a new school building, they vote against it, even though they do feel like K through 12 education is important.
Yes.
Yeah. And that unfortunately is the reality. That's why we have no parity with Medicaid in most states across the country.
in the healthcare industry, it's run by MBAs, administrators, all these non-doctor people, because doctor, you go in the room and do what you do best. We don't care about your opinion. Who has some ethics?
Right.
Business people, they don't have ethics. They do money. It's as simple as that. I don't know if you were, I mean, you were around, Sean, when when President Obama was in charge, they made parity for Medicaid lines of
Yeah.
businesses.
Yeah.
Everybody was at 100% parity.
Yeah. Great.
That's great.
Yeah.
What's wrong with that?
Yeah. There's nothing wrong with it.
That's
You
what
know?
we don't
Okay, here's what was wrong with that.
And the second that it wasn't required anymore, a
It went
lot
away.
of states dropped it, went away, right?
Yep.
Because even though they thought it was ethical and they thought it was a good idea, they still had to make their budgets balance. Okay.
Yeah.
And they didn't have the money and they didn't want to raise taxes. And so it went away.
But they did what they wanted to give you money to be able to get computers in your office through meaningful use. In order to do that, you had to get more Medicaid patients. Everybody got more Medicaid patients. They were in the office. You increase the parity with Medicare. Life is good. You know, you got your computers, you got your patients, everybody's in, and then boom.
You're triggering me. That's a classical socialist play.
What that is.
To promise something and give something to people and not have a long-term funding solution for it.
Or
And
you
then
give
It's not just socialist. That's what you're saying. And then it is.
when everybody's in the boat, you go, you're on your own now. And
Any
so the
different than
problem
what we
there,
were talking about with the
problem there
contract
is that
negotiations.
there was no long-term funding solution. That
Same
was all
thing.
paid
That's
by the
what shared
federal.
savings is. It's not a long-term funding solution.
No, but you have
It's
to.
not just socialists. It's everybody. Everybody
But
has
when
a
I
big
talk
plan.
about these plans, I like to hit everybody. I like to make everybody upset at me, not just one person. If you're going to make one person upset, why not make everybody upset? Okay. But for this ethical funding of preventive care for children and young adults, it should come from an excise tax of health system revenue, insurance companies' revenue, and not-for-profit institutions who are not paying taxes. 1%, 2% is nothing to them. And it goes like to the Federal Deposit Insurance Commission. The banks have to pay an excise tax, a percentage of their assets as into this program that the appropriators in the Hill can't touch. So the funding's always there. You don't raise anybody's taxes, and it's equitable because you know
But
what?
when here's the kicker.